Spines are really complex, and people don't come to us saying, hey, I want you to solve for my disc herniation, right? They say, hey, I have back pain. Every so often it radiates down my leg, but here are the real circumstances. It keeps me from picking up my children, doing X, Y, and Z. Really, our primary objective is to solve for that condition. It's not to solve for the underlying pathology like a disc, right? Now, yes, that can be part of it. That can be contributing to their symptomatic presentation. But because spines are complex, there are many pain-sensitive tissues in a spine. It's not just the disc. There are facet joints, there's ligaments, there's myofascial tissue, there's neurology, there's associated joints like SI joints in the low back. The shoulders have to be paid attention to in the neck. So there's lots going on that can contribute to the symptoms that they present with. And I think this is where, traditional medicine, especially from a surgical perspective, kind of fails. You can't cut all the tissue out to solve for symptoms. That just doesn't make sense. It does make sense to cut things out that can directly affect the overall symptom, especially if there's like leg pain. That makes sense, but that leaves the patient with other deficits in terms of pain patterns and dysfunction and other things. So what regenerative medicine allows us to do, it's a really unique approach. We can apply as little or as much as we need in order to treat regions of the spine, and that includes all of the associated tissues that I described. So not just the discs, but also the facets and ligaments and myofascial tissue and SI joints and even the neurology, without the risk of side effects or downside. And really what that does is it allows us to take a global approach to healing the entire spine. And ultimately that gives us a much better long-term outcome because we're able to solve for most of the pain patterns. If anything in this video resonates with you or you have any questions, please feel free to reach out to our office so that we can help.